Hello everyone, Dr. Eaves here at Southwest Brain Performance Centers, another addition to the virtual learning series. Today I'm just going to talk a little bit about our sports injuries and functional neurology. So people with sports injuries usually have some sort of neurological deficit or challenge. And I'm going to go over today just quickly. You're going to watch me go through like a very fast exam, not very thorough and in-depth, just kind of an abbreviated version, because our exams are usually an hour and a half long, so I don't want to make an hour and a half long video. But I'll show you kind of how we assess the nervous system. We look at the output of the nervous system, and if it's not functioning in everyday people, if your nervous system isn't as optimal as it could be, you can have little things like balance issues that lead to changes in reaction time, which lead to sports injuries. So there's a lot to go over with this, and I'm going to do a quick video after this to show you exactly what I'm talking about. Concussions. So a lot of times in concussions, people get hit on the side, in the back, in the front. They get a kind of a whiplash of their head. And what we know happens is the brain does shift inside the skull. So if you look here, this is called the gray matter. This is, your classic, when you look at a side view of the brain, this is where all of your brain cells live. And then here is the white matter, see? White matter. And what that is those are cables that connect one part of the brain to the other. So you'll see white matter leaves and it goes to another part. All the white matter will start from the outer layers of the cortex and they funnel down into the brainstem and down into the spinal cord. And what happens when this brain gets shifted, it will shift in a concussion and torque. And we know that that kind of disrupts those what we call cables or white matter tracks. And when that happens, certain parts of the brain don't talk to each other efficiently. And when they don't talk to each other efficiently, we see problems with eye movements, we see problems with balance, we see problems with headaches, we see problems with just being able to play their sport efficiently. We actually even see little sports injuries like ankle sprains and knee problems, and it all comes from the brain's not communicating effectively. That's what happens in concussion. Okay, so we're going to go over just a very quick motor exam that we do with our neuro patients. And again, this does not include eye movement assessment and a bunch of other testing that we do. We're just going to do a brief motor exam, so you might see this if you ever were to come and get your brain checked here at Southwest Brain Performance Centers. Okay, do this one. Do it 10 times, big and fast as you can. This side. Okay. And down front. When I touch one of your fingers, you touch the tip of your nose, and you come back. Okay? Close your eyes. And push down on your hands. Hold them up. Keep your eyes closed. Do it again. Yeah. Okay. Hands right here. Hand out. Up. Down. As fast as you can. 10 times. Hands out. 10 times as fast as you can. Over on. I want you to take this leg, drag it down that shin, and then back up. On the other side. Okay, take that heel, tap it on the shin 10 times. All wide open. Paper, rock, scissors. Do as fast as you can. Switch sides. Okay, stand up for me. Stand right here. Feet together, hands by your side, eyes closed. And you march, place. You keep marching, but close your eyes. Stand on the phone for me. Now we're taking away proprioceptive input, and your brain's now got to rely on more of your balance centers and your vestibular system.
Actually, really don't.
Alright. Okay, step off for me. Let's take a few steps back. I want you to go heel to toe, walking towards me, eyes open. Now go reverse. Okay, now we're going to check joint or cervical joint position error test. So we're going to use a motion guidance laser as you see here. And we're going to have her move her neck in different positions. She'll close her eyes and put her head where she thinks straight is. And then she'll open her eyes, and then we're going to be able to measure if she knows where her head is on her body. So let's look at that real quick. So go ahead and do 3 right head turns for me. Nope, farther right. A little bit further. Further. Okay. Now close your eyes and move your head right. Yeah, bring it back to where you think neutral is. Open. And so you see right there, she wasn't very far off. But a lot of times we'll put people's heads in different positions, and they'll be way off. They'll be off the chart sometimes. It's because when you get a concussion, you don't just get a head injury. You usually have a cervical spine or a neck injury on top of that. So another test that we can do is active and passive ranges of motion and cervical dissociation, just to make it fancy. I'm going to rotate your body right and left. Your job is to keep your head still with that laser as close as you can to the center target. Okay? So. This can be really difficult with those neck injuries. Okay, now I want you to rotate your body. And we can see actively and passively what is their control. This is right. And that's pretty good. Okay, take your left hand, kind of flat, right hand, paper. Paper, check my brain.